him take a breather.
Mm-hmm. Mm-hmm.
But when we come back,
Still.
I just thought that, if I asked you, if you had poor embryo quality, and how would you decide whether you thought it was the egg or the sperm?
Yeah.
Okay?
Mm-hmm.
Say, for example, you didn't really, you weren't really disgusted at the eggs that you were looking at, so it definitely fulfilled that okay group of eggs.
Mm-hmm.
And the patient wasn't somebody who was exceptionally old, and didn't have exceptional risk factors like endometriosis or previous surgery.
And say the sperm also wasn't a terrible quality.
And the sperm was acceptable. I mean, it was well within the acceptable range. So you had both the eggs and the sperm that looked quite reasonable.
Right.
So how would you start to look suspiciously at one or the other?
That is that $64,000 question that we often have to ask. So,
why is it 64,000?
Why? It's an old reference. We could say that's the $1 million question, but it used to be $64,000 question, which was a game show in the US, and you would win $64,000 if you got the top one right.
Just had to ask them something.
No, that's good. I realized that. Yeah, why 64? I'm not sure why they chose that number. So that is the $1 million question. It's really when we get to that point, we say now we're not getting embryos to grow, which is the sperm or the egg, and we're often left with putting our hands up in the air and we're not sure. So then we have to make educated guesses about which could it be. And so when we look at the sperm, we say, well, are there any other lifestyle things or other factors with the man that might influence that?
Sure.
Does he smoke? Is he overweight? And those are soft factors. They're not clearly linked to why they would be poor quality embryos, but it's at least something you can point to. You can say, okay, lifestyle modifications for you, sir, that's going to help your embryos potentially.
Sure.
With the most of the cases, though, again, as we said earlier, the egg brings so much to the early embryo development that it's usually the egg.
And that's probably why most of us tend to move in that direction.
Right. Mm-hmm. And of course, that's one of the more challenging things to address because it's very challenging. You need to fix the eggs to actually say how does the future mom become a better egg producer. It's not a very good way to say it, but
how do we optimize retrieving better quality eggs?
Well, how do we work with the patient to both make better and allow us to collect better eggs that result in good embryos? And that's a big challenge. But there's many things that you would recommend for that patient. We would look at it though and say, and sometimes this happens where you have someone that has long-standing infertility, where it's like 5 years and everything's been normal, and you say, well, and they're young. Let's say they're only 28, and they've been trying for 5 years, and you say, wow. Often they'll come in and the eggs look okay, but the embryos just don't develop at all. And that's usually a sign that there's just something inherently wrong or inherently broken in the way the eggs are being developed. Yeah, and there's not much we can do about those cases.
But those are rare, right?
Yeah,
those are rare. You're right. I think the box-standard patient probably goes through a bad cycle. And we've all seen that patient. I've seen that a number of times. The patient who produces 4 average embryos and doesn't get pregnant, and then there's another cycle with 2 average embryos, and doesn't get pregnant, and has the energy to try for the third time and produces 9 blastocysts, and gets pregnant, and has embryos sitting around just waiting for her to come back. She's just got more than she needs. And how do you explain that? She's older, same husband, same ovaries.
Well, we go back to, part of it is around the way the eggs are coming out. So when we think about, eggs have to mature 2 ways. We know that they need to have the right nucleus, so it's about maturity, the way they look, but then it's the maturity of the cytoplasm that we can't see. So do they have all the machinery ready to go for the sperm? When Mr. Sperm shows up, are the eggs like, okay, we're ready? And we can't tell that by looking at them. And so if those eggs are still immature in that way, so they're just not ready for the sperm, even though they look like they are, then they can result in bad quality embryos. But then the next cycle, suddenly for some reason, something's a little different. The eggs are starting to grow at a different point when we start to stimulate them, and we get ones that are suddenly mature and ready for the sperm, and then they develop fine.
So that explains why they can be a real cycle-to-cycle variation, despite the same drug.
Very much with the cycle-to-cycle variation with the eggs, no doubt.
Yeah. And I think that's also why I keep telling patients, never see it like an engineer sees it, because engineers always see it as 1 + 1 must equals 2. But humans are so not, machine-like.
Right. No, we're quite variable.
Yes.